Hi, this video is about nursing education requirements beyond just the BSN. It's more talking about advanced practice nursing and beyond the BSN, although BSN may be touched upon in this. There is a separate video about the history of the BSN and some research. So advanced practice roles. Advanced practice nursing, there is a wide encompassing group of nursing positions that are specialized. When you're in an advanced practice role, it's going to require more education and training. Some involve direct patient care, others focus on special patient population or a certain area of practice. The most common advanced practice nursing roles include the nurse practitioner. They're advanced practice registered nurses who provide primary and specialty patient care. They can diagnose and treat illness and prescribe and educate patients on preventative care. The clinical nurse specialists are APRNs who specialize in a specific area of nursing practice, such as oncology, pediatrics, critical care, gerontology. They provide direct patient care, they educate staff, they may conduct research or implement evidence-based practices. The certified nurse midwife specializes in women's health, particularly in pregnancy care, childbirth, and postpartum care. They provide prenatal care, they assist during labor and delivery, and can provide gynecological care. The CRNA, the Certified Registered Nurse Anesthetist, they're advanced practice nurses who administer anesthesia and take care of patients and monitor them during surgical procedures. They work in collaboration with the surgeon, the anesthesiologist, and other healthcare team members to ensure safety during surgery. Nurse educators are experienced nurses who teach and mentor aspiring nurses in academic settings to provide education and training in not only in academic settings, but in healthcare settings, in education departments, and they play a crucial role in preparing the next generation of nurses and ensuring high-quality patient care occurs, either by educating in the hospital or by preparing strong nurses. The scope of practice for nurse practitioners, it varies depending on the state or country in which they practice. They're different all over the place. There are some common elements that would generally define the scope of practice. First is assessment. They're trained to conduct comprehensive assessment. They can diagnose an acute and chronic illnesses and conditions. They can implement treatment plans, which includes prescribing medication, therapies, and other interventions. They educate on health promotion, disease prevention, and self-care. They collaborate with other healthcare professionals, including the physician, to provide comprehensive care to patients. Specializations, some nurse practitioners have specialized areas such as family practice, peds, geriatrics, or women's health, which can further define their scope of practice. A nurse practitioner is an autonomous practitioner. In most jurisdictions, they have the authority to practice independently without the direct supervision of a physician. This means they can see patients, diagnose conditions, and prescribe without needing the doctor's approval. So it's really important that they stay current with regulations and guidelines governing their practice so that they don't overstep and always practice in their area of safe, effective care. The scope of practice for clinical nurse specialists, advanced clinical practice. They're experts in specialized care in areas such as oncology, critical care, psych mental health. They provide direct patient care, often managing complex and high-risk patient populations. They serve as consultants for other healthcare providers, including physicians, offering their expertise and guidance on care issues, healthcare policies, nursing practice. And they play a key role in educating and training nurses and other healthcare providers within the hospital. Many are involved in research, quality improvement. They may take on leadership roles in the organization, and of course they collaborate. And the scope of practice for a CNS is most often defined by they have specialty certification, what education they have, and their experience. They have to stay current with regulations and guidelines governing their practice to ensure they are providing safe, effective, and evidence-based care. Nurse midwives, as we've already discussed, that they are APRNs who specialize in providing health care to women throughout their lifespan, mostly gynecological care and care around pregnancy and childbirth. So prenatal care, labor and delivery, they can assist during labor and delivery and provide support monitoring fetal and maternal well-being and managing pain, and provide postpartum care. They provide annual exams and pap smears and family planning services and other gynecological care. They might provide some primary care, including health screenings, preventative care, and health management of chronic conditions. They collaboration, referral once again, and patient education once again. CNMs practice in a variety of settings: hospitals, birthing centers, clinics. They're licensed highest healthcare providers with prescriptive authority in all 50 states and the District of Columbia, so that they can prescribe meds, including pain management medication and contraceptives. The certified nurse anesthetists are, as we said, they're advanced practice nurses. They deliver anesthesia. So they administer anesthesia, include general, regional, and local. They assess their patients and order diagnostic tests as needed to determine what anesthesia is appropriate for the patient, and ensuring that patients are cared for appropriately. They monitor the delivery of anesthesia during the surgical procedure or other procedure, and many may administer pain management technique like epidurals or nerve blocks to help manage the patient's pain during and after the procedure. So the scope of practice, of course, they have to have airway management. They intubate and can ventilate and order ventilations. They make sure that patient's airway is intact during anesthesia. They respond to emergency situations like a code team and help to stabilize patients. They collaborate with other care providers. They work in a variety of settings: hospitals, ambulatory surgical centers, and physician orders offices. Usually a nurse anesthetist, although an independent practitioner, works in tandem with a physician. Most advanced practice nurses have a collaborating physician, so if the care exceeds their scope of practice, they have somebody to hand off care to. And of course, they have to have prescriptive authority, because you can't deliver anesthesia without the ability to order medication. Now, nurse educators, they're a little different because they are working on educating nurses, and their scope of practice includes curriculum development, classroom instruction, supervising students on the clinical, evaluating students' knowledge, skills, and clinical performance to determine if they're ready for safe entry into practice. They conduct research. They engage in ongoing professional development. They have to stay current in both education and nursing evidence-based practice. They mentor students, and they also may be in a variety of settings, not just colleges and universities, but also healthcare organizations and hospitals. They might teach in nursing programs or continuing education programs for practicing nurses. Nurse educators have to stay current because you can't teach if you don't know what is the current practice to make sure that the students that you're educating are prepared for the clinical settings that they will be working in. I'm not going to go into these specifically, but you can read in the PDF which education, clinical preparation, and certification is required for the different advanced practice nurses. To be certified as an advanced practice nurse, there's usually a national certification process, and with educators, to teach directly, to be a clinical instructor, like as a part-time with the supervision of a master's prepared nurse, you can have a BSN, but most nurse educators have a minimum of master's, and some institutions want you to have a DNP or a PhD in nursing or related field, especially for higher level and academic positions. You also have to have an unrestricted nursing license. There can't be any restrictions on your nursing practice. And the certified CNA exam is a certification for educators. And some of your instructors, I don't remember. I know that Dr. Hammond is a CNE. I don't know who all else has that, but several of our instructors got that credential, even though it's not a requirement as part of their continuing education. Public policies impacting advanced practice nursing. Any scope of practice laws, physicians like to try to restrict the scope of practice because they're afraid it's going to infringe on their practice. But we know that there are not enough primary caregivers, not enough family practitioners, not enough adult nurse practitioner. There's not enough people to provide primary care. And advanced practice nurses are filling the gap. There's policies related to reimbursement. They have to get credentialed and recognized and get numbers set, as a care provider. You get a Medicare number, a Medicaid number, so that you have to be approved by the insurance and Medicare and Medicaid to be able to practice and get reimbursement. And then some states have collaborative practice agreements so that if something goes outside your scope of practice, you have somebody who you can immediately call upon. Prescriptive authority. If there are restrictions on prescriptive authority, it can limit their ability to meet the needs of their patient. This is an area that physicians have a lot of angst with. They're afraid that nursing is taking over, but there are not enough physicians, and where nursing especially could provide ongoing health maintenance, preventative care, it's an amazing thing. Telehealth policies, they can impact an APRN's ability to provide care remotely, and it's very important for rural underserved nurse areas, so that if policies block the ability of the advanced practice nurse to be reimbursed for telehealth, that can be a problem. And education and certification requirements can become a barrier. It was always a master's degree. The DNP, a Doctor of Nursing Practice, was actually a doctoral degree developed for advanced practice nurses. And right now, some states you're required to have that doctorate. Other states, you have so many years to get it. Other states, it's still a master's being the entry-level degree. Special interest groups in nursing education policy. A lot of special interest groups play a significant role in shaping healthcare policy related to educational requirements. They can be professional association, advocacy organization, other industry groups. They want the policies to align with their interests and goals when it comes to advanced practice nursing. A lot of groups, advocacy groups, support policies from the feds that support the educational needs of nurses, such as increasing funding for education programs, scholarships, loan forgiveness, and support for continuing education opportunities. They conduct research and gather data to support the policy positions that are advantageous to advanced practice nursing. They build coalitions, and working together, you can amplify your voices, as we've discussed. They help to analyze policy to help policymakers make informed decisions. And they may engage in lobbying efforts to influence lawmakers to support policies that align with goals. They can play a crucial role in shaping policy related to nursing educational requirements. Hopefully, they will be advocates on our side and not advocates working against advanced practice nurses. There are several major interest groups in healthcare that advocate for various policies related to nursing education requirements for entry into practice. The American Nursing Association, which was the initial paper in 1965 about the BSN. The NLN focuses on promoting excellence in nursing education at every level, including advocating evidence-based teaching practice, promoting diversity and inclusivity, and supporting faculty development. The American Association of Colleges of Nursing represents baccalaureate and graduate nursing programs. They advocate for increased funding for nursing education and expansion of nursing workforce development programs, and, of course, support for nursing research. The National Councils of State Boards of Nursing, they advocate for consistent standards for nursing education and licensure, supporting the use of evidence-based practices, and promote regulatory processes to protect policies to protect the public. And the National Student Nurse Association represents nursing students and advocates for policies that support nursing education, including increased funding for programs, support for student loan forgiveness, etc. I have for your reading pleasure here the agenda of some special interest groups, what they say about entry into practice and advanced practice. You can read those on slides 24 and 25. I'm not going to read these slides to you, but they are there. This is what these major organizations stance on entry into practice and advanced practice. What are the advocacy strategies? Sorry about that. Lobbying, we've talked about these. Lobbying, coalition building, public relation campaigns, grassroots advocacy, research and data, legal action, education and outreach. They do all of those things, just as we've learned this semester, to advance their goals. The general policy issues being addressed by major nursing associations, they may be varied, but they generally include safe staffing, nursing education, workforce development, scope of practice, healthcare access and equity, patient safety and quality of care, healthcare reform, and professional development. These are, and you can see what else if you looked at the announcement where I sent you to several of the major organizations and what their political platform, what they were focusing on to help you with your paper. You can see where their advocacy efforts are. Thanks, and have a great week.